Hello, everybody, and welcome to this short introduction to me. I'm Maldonado, and I am currently a professor of pediatrics and infectious diseases in the Department of Pediatrics. And for the next time being, I will also be the interim department chair for your Department of Medicine. I am very excited to be working with you. And I just wanted to introduce myself to all of you if you haven't already had a chance to speak with me or hear some of my other webinars or town hall meetings. So let me tell you a little bit about me and about what you can expect over the next several months. I, first of all, am a pediatric infectious disease epidemiologist. And I have been at Stanford a long time. I went to medical school here. I did leave to go to do my training at Johns Hopkins in pediatrics and infectious diseases. And after that, I spent some time as an epidemic intelligence service officer at the Centers for Disease Control and Prevention. Following that, I was fortunate enough to come back to Stanford, and I have been on the faculty here ever since for more than 30 years. I have really gotten a chance to know this university, the department, and the whole School of Medicine, as well as the two hospitals very, very well, in addition to living here very close to the department. So I know this area, I know the people, and I really think I will bring all of that knowledge and understanding to help support this department. Now, what about what I expect to do while I'm here? Well, I was very excited and a little bit surprised and sad, of course, to hear that Bob was leaving. But the dean and the two CEOs of the hospital really felt that my work in the dean's office, as well as my work in the hospitals and with the university, would give me the background to be able to support this very, very exceptional Department of Medicine. And that is fully what I intend to do. I am really just here as an interim chair to be able to support your amazing leadership, your amazing senior and mid-level staff, and all of the frontline workers that make up the Department of Medicine. So I personally am also a division chief in the Department of Pediatrics. I just stepped away from that job so that I could fully concentrate on my role here. And so I understand what it's like to be a division chief. I understand what it's like to work to negotiate with hospitals and community members, faculty, staff, etc., to make sure that everybody feels welcome, feels like they are giving their best efforts, and that the department is supporting them to do their best. And so I am really excited to be able to take this on. I'm happy that the dean and the two CEOs, David Entwistle and Paul King, have fully supported my work as I start off on this wonderful journey with all of you. Now, one other thing that I am doing that I will be still spending some time with is I am the Senior Associate Dean for Faculty Development and Diversity at the School of Medicine. I've been doing that job for almost 10 years now, and it has been a really wonderful experience. And I'll tell you something else. In that job, I have had an opportunity to work with all of the leadership, not only in the School of Medicine, but at both hospitals and, as I mentioned before, at the university. I've also had an opportunity in that role to work across the country around leadership opportunities for faculty everywhere, as well as to really reinforce our diversity, equity, and inclusion efforts in our workforce, in our specialties, and in our general society as well, especially given all of the trauma that we have faced just coming out of the COVID pandemic and all of the social inequities that have become unearthed and more available to all of us as we have come through the last few years. So I am fully dedicated to helping this department work in those ways. I know you are already doing amazing things and have many initiatives in that area, and I'm fully supportive of all of those. Now, I also want to say that in the next few weeks and months, my main job will be, first of all, just to get my feet on the ground in the department, get a chance to know all of you. I, in particular, want to meet the division chiefs, and I have really almost finished getting to know most of them. I know most of them in other roles, but as department chair, I really want to help understand what their issues are, and they are advocating for all of you for sure. And so that'll be my first role. And then I want to help tackle all of the issues that we face on a day-to-day basis, being clinicians, teachers, researchers, and administrators. Some of you do all of those, some of you do some, and I want to be able to make sure that you're all be able to do that work and continue to do the work that you have been doing, and try to make this transition as seamless as possible. So I will be engaging with all of you as time goes on, and the staff here in the department office is stellar. They are amazing, as you all know, and I will continue to support them as they support me in this role. Now, in parting for today, I just want to say that I am eternally grateful to Bob Harrington for all of the work that he has done in this Department of Medicine. I want to wish him well in his new role. He is going to be an outstanding leader, and he has been one here. You may know that I was on the search committee some years ago when we were able to attract Dr. Harrington to come to Stanford and become our department chair. And he has really made this department something stellar, something that you should all be proud of. But I also know that we have so much more we can accomplish given all of the great opportunities that he has given to us. So I want to work with you hand in hand as we go forward over the next months or so. I want you to know that I will be there for you. I will be here to support you. And I will make sure that your voices are heard as we move through any transitions over the next few months to getting that new perfect department chair that will be here to help you continue your journey. So I want to thank you again for listening, and I look forward to our next time meeting in the next few weeks. Thanks so much, and have a great day.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.